Another very, very interesting sarcode, which I use a lot in today's times. I've spoken about this, but I will just tell you, is a remedy prepared from testes. Okay, this is a very, very important sarcode, testes. The first time I came to know about this remedy was a few years back, 15, 20 years back. And the homeopathic author who has written about this a lot is Alexander Blackwood. This is the gentleman from whom I was the first time inspired about knowing that, oh, this remedy exists. So first of all, as the name suggests, the remedy testes. Yeah. It's prepared from the testes itself. And this is now a very, very important remedy, an intercurrent remedy for me in men's health. If you're treating a case of a man who has a lot of, first of all, his testosterone is very low. He has a lot of fatigue, a lot of malaise, a lot of low sexual drive, low muscle tissue. Sometimes these men develop early premature senility, develop dementia, early dementia. They remind you of remedies like selenium. They remind you of remedies like Baryta carbonicum. Or even young men, young men whom you feel who could be either very, very effeminate, very feminine, or who can be extremely masculine, both ways. Just like how thyroidinum is is a remedy we use for hypothyroid as well as hyperthyroid. Similarly, testes is a remedy that I use even in patients whom I see very, very low testosterone, and also in patients who I see very, very high testosterone. A lot of early baldness, a lot of hair fall, um, male pattern baldness. Of course, it can't kind of cure it, but I believe it can stop the progress of it in many cases. What is also interesting is many men who develop a lot of fibromyalgia, who develop a lot of weakness, and just sudden depression. They are not able to tell what they are facing. Very often, I just give a dose of Testis 30, and it's a very interesting intercurrent remedy. At this moment, I'm talking to you about this remedy, testosterone testes, as an intercurrent remedy. Now, very interesting part is that I've used it even in women who are mannish. You can call, who have a very masculine kind of structure to them. Even their physical constitution is more masculine in that way. The secondary sexual characteristics are more masculine. They many of them also, for example, ovarian problems. Ovarian cyst, ovarian tumors. In that, the testosterone levels can go high. They can develop hirsutism. They can develop many deepened hoarseness of voice, the clitoris related issues, etc. And sometimes when you do the testosterone levels, you can ask them to do a hormonal assay, and you will suddenly see either that testosterone levels to be very, very high. Again, in these cases, you can think about testis 30. This is a very interesting intercurrent remedy. But the most fascinating part for me of what I have used, um, this remedy, testes, which I want to tell you, these are also some very important clinical indications that I want you to remember for testes. You can see hair loss, reduced bone mass, reduction in testicular size, reduction in amount of semen. Very low, very important is very, very low sex drive. This is also very important.